To facilitate the vaccination of homebound persons, we know especially many of our elderly, they are confined at home. They are unable to go to the vaccination centers. So to help them, the Ministry of Health, we have been working with the Health Promotion Board and also AIC, our Agency for Integrated Care, to deploy home vaccination teams for this group. So the team will comprise a doctor plus a nurse so that we can vaccinate these homebound persons in the comfort of their home. Next, for those aged 40 to 44 years old, thank you very much for your patience and understanding. Registration for you will open from 19th of May, tomorrow. Another piece of good news is that the Health Services Authority, HSA, has also extended authorization for the use of the Pfizer-BioNTech COVID-19 vaccine for individuals aged 12 to 15 years. And our expert committee on COVID-19 vaccination has also weighed in on that endorsement, with their endorsement. So both teams have assessed that the Pfizer-BioNTech COVID-19 vaccine demonstrated high efficacy and safety for this age group of 12 to 15, and which is consistent with what we have observed for the adult population. So MOH will work with the Ministry of Education, will provide allocation, and MOE will plan out the vaccination for this group, which are all in schools, and MOE will provide further updates soon. Let me now move on to what I talked about last week. Was it last week? When I talked about the possibility of extending the gap between dose 1 and dose 2. I explained that at that time, if I may recap, the earlier phase of vaccination so far, we have been focusing on people who need it the most, vulnerable groups, as well as those on our front lines. And we give them 2 doses, give them maximum protection. Now that we move on to younger groups, there is merit to think about how to do it differently, giving priority to first dose so that we cover as many of our population or as big a proportion of our population as possible. So the expert committee on COVID-19 vaccination has studied this, and they have assessed that the maximum interval between the mRNA COVID-19 vaccines could be extended up to 8 weeks to maximize vaccine coverage without materially impacting the eventual overall immune response, as long as the second dose is eventually administered. This conclusion corroborates with the data from the original mRNA trials, which has been bolstered recently by emerging information from real-world observations, lab studies, as well as simulations. The approach of prioritizing first-dose vaccinations has also been adopted by other countries, such as the United Kingdom, as well as Germany. We will therefore expedite access to vaccines for more people, given our supplies, by extending the interval between the first and second vaccine doses, which is now 3 to 4 weeks. We will extend it to 6 to 8 weeks. And this will apply to vaccination registrations that occur from tomorrow. Maybe if I will just roughly explain how this works. Intuitively is this. Every time you give someone the vaccine for the first dose, 3 weeks later, if you are taking Pfizer, they will be back to take the second dose. When you extend it, basically that demand is pushed back by another 3, 4, 5 weeks, which means you free up that dosage for that day for more people to take the first dose. And that's how it works. And the end point is the same, which is at the end, everyone will get their 2 doses. But now we prioritize giving out more first doses early and then more second doses later. Yeah, end point is actually the same. The difference is that we are trying to, instead of having a good number of people getting maximum protection, we make sure we get the maximum number of people get good protection. Yeah. In Chinese, 与其好一些人得到最多的保护，倒不如给最多的人得到一些好的保护。